Okay, guys and gals, Chapter 6 EMR. Curtis again, we're going to knock this thing out about the human body. So in this chapter, we're going to learn a little bit about some kind of major organ systems and then a little bit about that special language that we talked about, that kind of medical terminology language that we're going to need to know and to be able to communicate with people and document things and all of that. So you see here, we're going to understand some basic structures and functions of the human body. As an EMR, we need to be able to do that to be effective. What this is going to do, it's going to help you better understand the specific location of symptoms, because we're going to name some very specific terms that will describe where it's at. So what we're talking about is those symptoms that the patient is experiencing. We're going to be able to help talk about specific locations and things like that. We're going to talk about performing an adequate patient exam. That's also going to help us, this knowledge, and then communicate our findings to other members of the emergency medical team, and then provide appropriate emergency treatment for the patient's condition. Now, topographic anatomy. You'll need to kind of pay attention to some of this. It's pretty important of what we're talking about. So anatomic terms are used to describe the location of an injury or pain. So anatomically, you see things up there. You see about superior, which is near the head, or anterior. So you might hear about someone's anterior chest, or inferior. Then you see over on the other side, you have medial and lateral. So lateral is away from, what I remember with medial is towards the middle, and lateral is away from the middle. And then posterior is going to be rear, and proximal and distal. We're going to talk about these and in just a slide or two mention it. But if you'll look here, proximal is going to be, say it's more proximal to the shoulder, okay? Or we could even say the elbow. The elbow is more proximal than the wrist, because the wrist is distal. It's distant. It's distant away from here, so it's farther away. So proximal and distal. Lots and lots of words, lots of this language that we're talking about. So we see here that anterior is the front surface of the body and posterior is the back. And then midline, that refers to an imaginary vertical line drawn from the head to the toes that separates the body into the left half and then separates the body into the right half. Now, some of those things we were just looking at. So some of those standard anatomic positions. Medial means closer to the midline. That's what we're talking about, closer to the middle. Lateral means away from the midline or away from the middle. Proximal is going to be close. Distal is distant. So remember when we were talking about like the elbow and the wrist, the elbow is proximal, the distal is distant, or which would be the wrist, because we're looking where it's connected up to the shoulder. Superior means closer to the head, and inferior means closer to the feet. So lots of probably may or may not be new words, but the way we're going to use them is a little bit different than most people without any medical experience are going to have used words. So let's talk about the respiratory system. Going to be pretty important in what we're doing. So the body systems, when we start talking about body systems as a whole, they work together to perform some common functions. So we start off, we're going to talk about the respiratory system. So it consists of, all of the structures of the body that contribute to normal breathing. The respiratory system brings O2 into the body and then removes the waste gases, being carbon dioxide, and it allows that to escape, because that's nothing but, those are toxins to us essentially. So you see over here, this is going to be our upper airway. So air comes through here through our nasal cavity and through our oral cavity, comes down through here to, as you see located, going to be our trachea, comes down into through the trachea. Now this bifurcation here that you see, that's going to be the carina. So that bifurcation means, think about when you pull up to a stop sign, you can go left or you can go right. That's what we're talking about here. You see the right side is not as sharp of an angle as the left. So in advanced treatments, it's really easy for a tube to get pushed into the right main stem versus into the left, because it's not as sharp of an angle. You see the ribs are protecting everything with the intercostal muscles. So we go down, we start looking at within the lungs. We have the diaphragm under here. It helps in the normal breathing process. And we got our main bronchus and then our bronchioles. And then we'll show you a slide here in a second that gets a little bit further down into what's going on in these little areas here. So the airway, nose, the mouth, the throat, the larynx, the voice box, the trachea, the windpipe, passages within the lungs. This is all about being able to get air in, good stuff in, oxygen in, and CO2 out. We want to get carbon dioxide out. So here's what we're talking about. Within the upper airway, you have your nasopharynx, your oropharynx, and you see these where these are listed. So nasopharynx and oropharynx, and then just your pharynx. Epiglottis is important to remember because right here it's this little flap, kind of a leaf-shaped structure that helps to allow things to go to the right place, meaning air to go into the lungs and water to go into the tummy, because if you were to flip-flop that's going to be a real problem. We should not put water down into the lungs because that helps drown people. So we don't want to do that. So what that does is opens up the esophagus for that water to go down into the stomach, which is behind here. You see the esophagus is right here. So it's behind here, and then it goes down and empties out into here. Now, here's where I was talking about these little bitty pieces right here. So we're talking about the alveoli. This is where kind of the action happens for this particular process for the respiratory system. So O2 and CO2 are exchanged in the alveoli and the tissue. These are the alveoli here, these little berry-like structures, these little sacs. All of these are lined with capillaries, as you can see over here. So you have O2 being exchanged with CO2 and at the cellular level. And that's what we want in the lungs. That's what we want. We're bringing in oxygen as we breathe in, and as we blow out, we're blowing out CO2. So it's this constant change that happens throughout this area here. So we talked about, I'm sorry, I had to stop it for a second. We talked about all of the business happening here. Now, one thing to think about is based upon what the body needs, whether it's more oxygen or it needs to blow off more CO2, or the oxygen is too high and the CO2 is too low, the body will compensate with that, and it will either speed up the respiratory status, meaning the respirations, or it will slow them down. If the body needs more O2, so think about when you're out, when you're out running or something like that. If you happen to do crazy stuff like that, then your body needs more oxygen, and it causes you to breathe faster. Same thing, if you're breathing really fast, the body will try to slow you down because it messes up the blood gases within the body, and it wants to maintain that word you may have read up to this point, but you'll hear it somewhere, homeostasis. So we want to maintain everything kind of at its optimal, at its desired level, and the body is trying to do that by increasing the respiratory rate or decreasing it, whatever it needs to do. So that's kind of the respiratory system. Now, one part of it, we pointed out the diaphragm, which we know is under here. This is going to be our diaphragm area. So air is inhaled when the diaphragm and the chest muscles contract, and then air is exhaled when these muscles relax. So it's an active and a passive process. So the air is exhaled when the chest muscles relax, and it decreases the size of the chest. So air is inhaled when the diaphragm moves downward, as you see in your picture, and the chest muscles contract to expand the size of the chest. That's going to be kind of how this whole process works muscularly as it's going on within our body. Really, any kind of deviation from that, for the most part, is going to be bad because it affects somehow one thing will always affect something else down the line. So if the diaphragm isn't working well, or there's some kind of injury to the ribs, it won't allow the person to breathe properly. So there's a lot of moving pieces to this. Now we'll get into circulatory system. We talked about we're going to look at several different systems. So the circulatory system, as you see listed, it includes heart, blood, and blood vessels. So what we're going to say is within this, we're going to say this is the pump, kind of bringing it down to just some everyday standards of what we do maybe at work or what we've done in the past. This is our pump. It's pumping blood, in and out of the heart. So it's pumping that oxygenated blood that we got with the lungs that got grabbed onto those oxygen molecules onto the red blood cells. And now this guy right here is going to pump it throughout the body. That's why you see the red and the blue. One is going to be oxygenated. The other one is going to be deoxygenated. So as you can imagine, that's why we see that color. The red is going to have oxygenated blood in it, and that's what we want. It's going to send it all out to the vessels. So through these vessels, we have the pump here, And then we have the blood, which is going to be kind of just the product, and it's just this closed circuit, right? So maybe like an air conditioning system or something like that. And then you have the pipes, which are going to be all of these vessels. And as this pumps, it pumps the blood around and it goes through the pipes or the vessels, and it's just this closed circuit system that continually works. So we see on the flow of blood, it picks up oxygen in the lungs and goes to the heart. And then that heart, that pump, it pumps the blood to the rest of the body. And then cells of the body absorb O2 and nutrients from the blood. But what it also does, which is a really big important part of it that we looked at a second ago, was it releases waste products. That's including carbon dioxide into the blood. Now, blood carries these waste products back to the lungs and the kidneys. And in the lungs, blood exchanges the carbon dioxide for more oxygen, and the cycle begins again. So much like those closed circuit systems, it just goes over and over and over and over. That's what we're talking about. It just happens over and over. Now, within the heart, within that pump, we have 4 chambers. So each upper chamber is going to be called an atrium. So you have a right atrium and a left atrium. And then each lower chamber is called a ventricle. The chambers work together to pump blood to the lungs and then to the rest of the body. So you have the right side of the heart that pushes blood into the lungs, and you have the left side of the heart which pushes blood to the body. So the right atrium pushes it down to the right ventricle, which then pushes it into the pulmonary circuit, which allows that to get oxygenated. So what happens is these chambers, though, as I mentioned, it works together to get this stuff to the blood and to the rest of the body. Now within there, we have these one-way check valves that are in the heart and the veins, so it allows blood to flow in only one direction, which you can imagine would not be a good thing if you had allowed it to go in both directions. Before it ever became reoxygenated, it could go backwards, and that would cause us a real big problem. So with those valves, that causes that to not happen. As you see here, we have the heart, all the pieces to it. So blood from the body, blood to all parts of the body, pulmonary arteries, so the blood to the lungs, pulmonary veins. So what happens is blood from the body comes through here. This is going to be our vena cava. Superior vena cava, hopefully you remember that. Superior, going to be top. Inferior vena cava, going to be bottom. Blood returns from the body into our vena cava, which goes into our right atrium. Here's those valves that we mentioned. These valves are not allowing it. Now, it's also, remember, it's also in the veins too. But these valves here allow the blood to not come this way. So the right atrium squirts the blood down into the left atrium, which then pushes it out here into the pulmonary arteries, which goes over this way, which we have the lungs up here. Once goes through and gets reoxygenated rather, then we see that it will come through here. Pulmonary veins, blood from the lungs comes into the left atrium, down through the left ventricle, then comes out here through the aorta. It can come all the way down that you see here, and then you see it going to all different parts of the body, and that's the oxygenated blood. So it gets pumped out by the left ventricle into the rest of the body. So that's a lot of pieces. You're not expected to know all that. We're just kind of talking through it. So you'll see as we move forward kind of what we're going to be looking at. So we mentioned that the arteries carry blood away from the heart, and that's at a high pressure. So that aorta, when we said, it carries the everything at a really high pressure, the blood at a really high pressure. So it does have to have thick walls. It is the largest vessel within the body, the aorta. Sorry, I had to restart. I'm having some brain fog here this morning. So I was trying to think of the word arterial, and I kept saying aorta. So when the aorta blood is pushing that oxygenated blood and you have an arterial bleed, that's why you get that really strong, bright red bleeding that you may have already seen or may not. But that arterial blood is being pumped at from a much higher pressure, and those arteries are much thicker, as we see here. They have thick walls. So there are 3 major arteries: the carotid, the femoral, or the radial. You see where they're listed: the neck, groin, and the wrist. Those are the different arteries. So major arteries, we use those to to measure the patient's pulse or the wave of pressure that's created by the heart as it forces blood into the arteries. And so we're able to that helps us determine a blood pressure. Here we go. So location of the carotid, the radial, and the femoral as we see them here. So carotid, we mentioned, was in the neck. We mentioned this was femoral was in the groin. Radial is in the wrist. Now, what you've probably seen, everybody up to this point in life, no matter who you are, you've seen some type of capillary bleeding is the smallest vessels. So it's just this little capillary network of these small vessels. So think of a paper cut, or think of even when you fall down and go boom and scrape your knee up or whatever, and you just have that kind of really just oozing, like just, it's dark red blood. It's barely even coming out. More than likely, you've done some damage to some capillaries. That's what we're talking about. So veins, they're going to be thin-walled vessels that carry blood back to the heart. That's one of some of the big differences when we talked about arteries and veins, was arteries carry oxygenated blood, veins carry deoxygenated blood. Arteries are thick vessels, veins are not thick vessels, they're much more thin vessels. And then within blood, you see we have several components. So plasma, red blood cells, white blood cells, and platelets. Skeleton system supports the body, obviously. It consists of bones and connective tissues that protect and support the framework for the body. So it has several different functions, supports the body, protects those vital structures, which are really important, the heart and the lungs, and these things need to be protected. And then one neat thing is within a skeletal system, you'll have within the medullary cavity of particular bones, you start to see some kind of regeneration of red blood cells. So you'll see the manufacture of red blood cells. Here's just a general picture. We're not going to go over all of this stuff. However, you do need to take a look at some of this. We're not going to go over all of it right now. We're going to go through some slides and talk a little bit about pieces. But you do need to know some of these things, the humerus and the ulna and the radius and femur. These things that are pretty common, you're going to need to know when you're able to give reports and that type of stuff as an EMR. So you are going to need to be familiar with this. But when we saw the skull, talking about the head, right? Bones of the head, skull and lower jaw consist of many bones fused together. That's a big part, that these bones are fused together. It contains and protects the brain. It's fused together because as a young child, it's not fused together. It's allowed to move so the brain can grow. And then once you get to a certain age, then it fuses together and does not allow that to grow anymore. The downside of that is Mima or Papa or any one of us really take a good shot to the head and your brain starts to swell. Well, that's a problem because it does not allow, the bone does not allow anything to move. So that can be a big problem. And then the jawbone, movable bone that's attached to the skull and completes the structure of the head. Spine has 33 vertebrae. You see the muscles, tendons, discs, ligaments, all of that. Spinal cord passes through the hole in each center of the spinal vertebrae. That's one of the really important things is those things get jacked up, whether it's at a weird angle or broken or whatever, and all of those nerves that pass through there, that can be a real big problem. Now, the spine has 5 sections, and you see it listed. So cervical, thoracic, lumbar, sacrum, coccyx, a lot of different sections. Here's kind of what we're talking about. As you see them listed, the 5 sections of the spine. 7, 12, 5, 5, and 4. That's the way through A and P and stuff that we're talking about. Cervical, this is a really big thing because within these upper cervical injuries, if they have a fracture, it can start to affect their respiratory center. So we see these are all different nerves and vessels and things that are leading to the spine. These nerves are controlling functions, and it's going to your liver and your pancreas and all of those things. So damage, especially up here in the cervical area, upper cervical, can cause some real problems. Each shoulder girdle supports an arm and consists of 3 bones. So within that, you have the collarbone, shoulder blade, and the upper arm bone. So the clavicle, the scapula, and the humerus. Upper extremity consists of 3 major bones. Upper arm has 1 bone called the humerus, and then down below, we looked at the forearm earlier. We said it was the ulna and the radius, and then the wrist and hand consist of several bones as well. Rib cage, 12 sets of ribs, protect the heart, lungs, liver, spleen. That's why it's going to be really important that those guys are there. We mentioned that those things protect a lot of different structures, so it's going to be important that they're there. Now, I didn't mention it when we talked about, I just kind of blew past it, but one thing it may or may not help you When we talk about the forearm, you have the ulna and the radius. That radius is located on the thumb side or the lateral side of the arm, and the ulna is located on the little finger or the medial side. So that's one way to help you remember the location of these. Rib cage, sternum. Here's what we're talking about. This is the sternal notch. This is the sternum, this area here. Xiphoid process is going to be down here. That's what hopefully you'll remember. Maybe you've taken a CPR class, or you will. And if not, you're going to learn this, but we do not want to push on that. That can actually break off that xiphoid process. So we want to use that as a landmark to make sure that we don't put our hands on when we're doing good quality compressions. Then we move on down inferior, right? Superior top, inferior low. Pelvis serves as a link between the body and the lower extremities. It also protects the reproductive organs and other organs located in the lower abdominal cavity. And then a lower extremity, so each lower extremity consists of the thigh and the leg. I know I'm just blazing through this, but there's not much to talk about. So not a lot of thinking. It's just a matter of familiarizing yourself and remembering. So within that lower extremity, you've got the thigh bone or the femur. Now it's the longest and strongest bone in the entire body. So the femur bone is, if you have a broken femur, that tells you there was a lot of energy that was transferred from whatever it was that caused that fracture. And then the lower leg has two bones called the tibia and the fibula. And much like the radius and the ulna, when you talked about the forearm, we have the same thing in the lower leg. Now the patella or the kneecap, that's a small kind of a flat bone. It protects the front of the knee joint. Then we move on down. Ankle and foot contain a large number, as you're aware, of smaller bones. Now joints, a couple of different joints that we'll talk about. These joints are where two bones come in contact with each other. That's where a joint is formed. So they're held together by supporting tissues called tendons and ligaments, and they're lubricated by a thin fluid that's contained in a sac that's surrounding the joint. So here's a couple of different joints that we may run into. So there's three types of joints. You have fused joints. They don't permit any movement between the bone ends. We mentioned that before. We're talking about like the skull. Those things have already fused together, not going to do any movement. Hinge joints, as you see here at the right elbow joint, is a hinge joint. So we see the hinge joint. It allows movement in one plane. So think about like the knee or maybe the elbow or fingers. That's what we're talking about with a hinge joint. And then a ball and socket joint allows movement in more than one plane. So think about like shoulder, hip, those type of things. Now, if movement occurs beyond the limits of these joints, injury and damage more than likely are going to occur depending upon how much energy and all of that was used. And that's going to be kind of just a quick overview of that. Now, the muscular system. Skeletal muscles provide both support and movement. They're all part of that skeletal system, right? These muscles cause movement, or they work together. These muscles cause movement by alternately contracting. So when you hear the word contract, you might think shorten or relaxing. If contracting is shortening, then relaxing is probably going to be lengthening. Because skeletal muscles are under direct voluntary control of the brain and can be stimulated to contract or relax at will, they're also called voluntary muscles. So because we can control that, that's why they're grouped into that muscle. Versus opposed to some of these other organs that we have, like the cardiac muscle we'll talk about in a second. It's not the same thing. It happens involuntary. So thankfully, we don't have to think about breathing and think about our heart beating and all of that. So smooth muscles carry out automatic functions. So a person does not have any control over the smooth muscles, which explains why they're called involuntary muscles. So the cardiac muscle found only in the heart. Cardiac muscle is adapted to its special functions of working all the time. It has a rich blood supply and can live only a few minutes without an adequate supply of blood. So an interesting thing is you can have someone that they still have like electrical cardiac activity, but there's nothing going on within the heart. It's not actually pumping, but it has this automaticity that allows the heart to continue. It generates its own impulse. So as earlier we were talking about these other, the skeletal muscles, us having to basically tell the arm to move or whatever, And what it's doing is kind of generating that automaticity to create that impulse and cause us to move. The heart has its own little pacemakers that cause it to do that on its own. So it's quite an astonishing organ that it just does all of these things on its own, and it's built to function that way. So it's pretty interesting. Now, the nervous system, we're still carrying on. We're still doing more systems. So nervous system governs the body's functioning. So nervous system, it consists of several things: brain, spinal cord, individual nerves that extend throughout the body. So the brain and spinal cord, they're going to be what is labeled CNS, or the central nervous system. And then the cables of the nerve fibers are going to be called a PNS, or the peripheral nervous system. Here's kind of what we're seeing. Connects the nerve cells, sensory impulse to the brain, motor impulse to the spinal cord. It's just this loop of these things happening. Motor nerve to the muscle forearm. It just goes down. So you have these thoughts that happen, and they go down, and stuff happens, actions happen, and then it comes back up that, hey, that hurt, or that was hot, or it's just this constant communication. So the brain is the body's central computer, controls some different functions. So thinking, voluntary actions, involuntary functions, that's a good thing that we talked about. So breathing and digestion and all of these kinds of things. Spinal cord's a long tube-like structure that extends from the base of the brain. Nerves branch out from the spinal cord to every part of the body. Now, digestive system breaks down food into a form that can be carried by the circulatory system to cells of the body. If it's not used, it's eliminated, and then major organs of the digestive system are located in the abdomen. Quick disclaimer here also, I'm not an A&P guy. So in the event that I've misspoken about something, please don't hold it against me. We're just kind of getting through this stuff. What I am is, I'm good at being an EMT and a paramedic, so I'll make up for whatever poor job I've done here when we get into EMT stuff. Deal? Good. All right, so digestive tract begins at the mouth, continues through these structures. So just much like we saw the air going through the mouth and the nose and down through the trachea and into the lungs and all of that, you have the same thing here. It comes in one place, stuff happens. So think about like within the respiratory system, went in the lungs and stuff happened, right, at the alveoli. Same thing, goes to the stomach, small intestine, stuff happens, breaks down, and then we blow out CO2. Much like that, we blow out all the other stuff too. So similar process, but completely different. So also includes liver, gallbladder, pancreas. There's a lot of important things that go on, obviously, within the liver and the gallbladder and the pancreas, but we're not going to talk too much about this kind of stuff. Now, the pancreas, something that we will see on some calls, the pancreas, insulin is made within the pancreas. So somebody with a pancreas injury, we could, or, just some end of life kind of things or whatever, disease processes, we understand how that could be a big problem because insulin works with glucose. So if you don't have enough insulin, next thing you know, you start talking about diabetes and different kinds of things. So lots of things going on within this entire system. Genitourinary system. Probably didn't even say that right. But responsible for body's reproductive functions and for the removal of waste products. As you see, the major male reproductive organs, the testes produce the sperm, and then as you see, you probably already knew this, but the penis delivers the sperm. So, seems like an odd slide, but we'll carry on. Major female reproductive organs. The ovaries produce the eggs, uterus holds the fertilized egg during pregnancy, and there's some times where this can become a problem, and the next thing you know, you have a ectopic type pregnancy where eggs aren't going in the right places, and as the body, because it is so complex, things have to work right, or there's probably going to be a problem. So, but the egg released by ovaries travels to the uterus through the fallopian tubes. That's usually where this kind of thing, when we talk about that ectopic pregnancy, sometimes they'll just get caught up in the fallopian tubes or some other place rather than moving the way that they're supposed to. And then external opening of the female reproductive system is called the birth canal, or as you are aware, the vagina. Removal of waste products begin in the kidneys, which filter blood to form urine. So it goes down from the bladder and leaves the body. Skin, all parts of the body is going to be covered by skin. 3 functions, as you see: protects, regulates temperature, transmits information. So it's hot outside. Your skin tells your brain that it's hot outside, and it tells you to go take a cold shower or to turn the air conditioner on or whatever. Dermis, deeper or inner layer of skin. Epidermis is outer layer of skin. Epi being above. And skin, as you see here, you have sensory receptors in the epidermis and the dermis, and then the subcutaneous layer and the veins and the arteries, and you see all these things. Adipose tissue. You may or may not see these if you go on a bad car crash or someone that's been caught up in an industrial accident or a stabbing victim. You will see some of these things, but you're not going to see, you're not going to look and go, oh, that must be an erector pili muscle. Probably not going to notice if that's what that is. However, you will, when someone gets a big, just cut right through here, you're going to see this adipose tissue. And this is fairly accurate. When you see it, it's going to be this weird kind of yellowish, off-white, weird globby looking substance, but you'll see these vessels going through there. And, you'll be able to notice some of this stuff. And when someone's kind of filleted open, you're going to realize that that's what some of this stuff is. So it's an effective barrier to bacteria. So that's why, we do want to when we're taking care of someone, if we're able to kind of clean things up, following your local protocols, of course, you want to be able to clean people up if you're able to, and be thoughtful rather than grinding things down into an open injury. We want to pay attention to the way that we're bandaging things and all of that. So skin, it does perceive or sense touch, pressure, pain, and then of course hot and cold. Stages of life, growth and development. So obviously through a person's life, the body changes constantly. It's kind of funny. I guess it's weird, but we start out as a baby and we don't hear so pretty good and we don't talk so pretty good. And then we go to the bathroom in our pants and all of these we need to be fed and all those kinds of things. And as you see where we're headed here, right? We go through life and we start functioning very well, optimally. And then towards the end, we kind of revert right back to that same status to where we may need to be helped with a lot of things. So what I'm trying to say is the body changes constantly. So in an infant, the airway is very small. It's easily obstructed by swelling or foreign objects. If you've not had small children, they like to cram things in those openings. So they may cram some candy or a G.I. Joe guy's, his little foot or something like that into these openings. So, be thoughtful about that with these little kiddos. What you also need to understand, though, is this: easily obstructed by swelling. So what happens is a small little kiddo gets swelling, meaning inflammation, meaning infection or allergies or whatever, and they already have a very small airway, and now it's become narrowed even more. So they're not moving good air in and out. So that's why it's important to get things cleaned out properly. That's why it's going to be important to constantly monitor airway. Many times you may hear people or see people feel like EMRs are maybe not all that important on the whole emergency services scale. Actually very, very important, because most times, more times than not, an EMR is going to get there long before a paramedic does. If you are, maybe you are or are not aware of it, but that's why police officers and firefighters perform probably more defibrillations than paramedics do. I would bet. I don't know that for sure. But because they arrive much earlier than paramedics do. So you have in the city where I'm doing this at in Shawnee, I don't know what there is on the street, but probably 20 police units on the street. And they have like 5 or 6 fire engines. And there's probably 3 ambulances. So you can see the problem. These guys are going to get there much sooner than a paramedic does. So it's going to be important that, I'm saying all this to say it's important that you understand your role in this system. It's important that you understand you as an EMR can make a difference where you live or your job. But you need to know what you're doing, and you need to understand the responsibility that you have as an EMR to be able to perform these skills. And we'll just kind of go hero talk, these life-saving skills, to be able to deploy them at the appropriate time to the appropriate patient. So that was what they call that soapbox. So we talked about swelling, or foreign objects. So at birth, infants can breathe only through their noses, right? Obligate nose breathers. So they just use their noses. So it's important to make sure that their noses are not obstructed. We're talking about that, right? We're mentioning it right here, talking about obstructed. If they get all that junk in their nose and get all that snot and everything else, obviously a little baby infant's not going to cram a M&M up their nose. Now, doesn't mean their big brother won't. I've had 4 boys. Big brothers are they will do that if you're not aware of that. But certainly there's snot and everything else that's all the time around little kids, so they can certainly get their airways clogged up with this. So we've got to be thoughtful about that. Infants lose heat very rapidly. That's why if you were privileged enough in this business and what you're doing, wanting to help your community or your job site or whatever, but if you're privileged enough to be part of a childbirth, you'll understand that, or you need to understand this, that infants lose heat rapidly. So it's important to keep them warm. So that's why if you've had a baby, you've seen them get the little hats put on them and they get really wrapped up super tight. It's because they lose so much heat so quickly. So it's important to be able to keep them warm. So because toddlers, and that toddlers, we're talking about 1 to 3 year olds, because they have poor coordination and balance, if you don't know that, just watch a 2-year-old walk around. They are at a high risk for injuries from falls. So if they're anything like my boys, where their head leads them everywhere. So they got this big old noggin, and they just kind of follow their head, and wherever their head takes them, that's where their body goes. And many times they fall down and they run into things. So it's important to understand that they are at a high risk from injuries and falls. And then school-age children, we're talking about 6 to 12 years old. They're physically active and prone to injuries from bicycle riding and other athletic mishaps. So think about monkey bars and jumping ramps on bikes. And of course, nowadays we don't ride bikes all that much or climb on monkey bars, but they might get some type of wrist injury from playing PlayStation or texting. Their neck gets sore from texting and that kind of stuff. It's hopefully the kids we're talking about, though, are going to be out on the monkey bars and having fun and running around and playing dodgeball. So, but there will be those little neck and wrist mishaps from their iPhones. So you got to be prepared, guys. Anyways, here we go. Another soapbox. Adolescence. We're talking about some adolescence. 13 to 18 is kind of what we're looking at. If you have ever been 13 to 18, which I expect all of you have, especially as a 13 to 18-year-old male, you kind of see yourselves as invincible. So don't really understand the consequences of dangerous actions. That's why the insurance companies, they do understand that. That's why it takes a while for them to give us a little bit of a discount, because it takes, if you go in to start looking into brain physiology, it takes a while for our brains to fully develop, and somewhere around the ages of 25 to 26 years old, as young males, our brains start to develop, and we start to realize that that's like jumping off a bridge into the river is a bad idea. Or, hey, watch this, hold this and watch this. Those are bad ideas. So those are all the things that we're talking about, adolescence, 13 to 18. But you can probably, with a lot of guys, myself included, you can probably take that from 13 to 30. Don't really understand the consequences of dangerous actions. So inexperience and risk-taking lead to a higher incidence of vehicle crashes among young drivers. You already recognize that, I'm sure. And now let's talk about early adulthood. So we're thinking 20 to just say 40 years. That's when most body systems are fully developed. So 20 to 40 years, most of these body systems are going to be fully developed and everything working, optimally, hopefully. And then middle adulthood, 41 to 60, generally the time when the body systems start to decline. Right? We kind of reached the peak. Think about the mountain. We climbed the mountain. We got at the top of the mountain. We put our flag up there and said, wahoo! And now we start to make the sudden decline of the mountain. So vision, hearing becomes less acute. Cardiovascular and respiratory systems start to weaken. Women experience menopause, and the book will tell you that during their late 40s and early 50s, men have their, which I like the word menopause. They start to have the same things, hormonal issues. And there's lots of reasons. I don't know when we're supposed to wear things out, like when we were created, like what the plan was. But there's so many toxins in this world, and we are becoming a society that is low on testosterone, low on the proper hormones. and through plastics and lots of other things. There's lots of research out there, but at the end of the day, it is what it is. So weight control becomes more difficult for most people. Then we move into late adulthood, 61 and older. Decline starts in middle adulthood and becomes more pronounced when we start talking about this late adulthood. So people in this age group are more susceptible to fractures and burns and falls. So we still fall down, right? We just don't bounce so pretty good. Things break, hips and elbows and arms and all of that. So also at this time, when we mentioned late adulthood, 61 and up, that's the incidence of mental decline and senility increases. So this is what we all have to look forward to. Some of us closer than others. Now, vital signs, going to be really important. I need you guys to understand how important this is. Vital signs tell us a lot of things. Vital signs tell us, at least it gives us an idea if enough blood, I don't know if that's not the right way to say it, and not enough, but if blood that is probably oxygenated is reaching the brain so that people can make decent decisions, and it's reaching the heart, and it's reaching the lungs, and all of those kinds of things, because these seem like some very simple numbers, and they are, but they tell us quite a bit when you understand how the system works. So that's why it's important to have at least a small grasp of anatomy and physiology, so the body systems, so you can understand that, well, when this is not working quite right, we're not getting enough out there. Think about your water hose at home, right? When you don't have enough water pressure and you turn it on, the water can maybe reach the sprinkler, but it can't be pushed through it. It requires a certain amount of pressure. It also requires a certain volume of water to build up that pressure. So it's all these kind of intricate pieces that end with the one number and the one goal and all of that. So our most commonly measured vital signs, we see them listed: pulse, or our heart rate, respiratory rate, or blood pressure, BP. So you could see pulse. Sometimes people would put a P and then the little equal sign that would say 86. Or you could put heart rate, so HR, equals. That's how you might document it. Respiratory rate, it doesn't have anything listed there, but you could have two R's. So respiratory rate, two uppercase R's will tell you respiratory rate. And then blood pressure, as you see, BP. So their blood pressure would be 120 over 82 or whatever. So normal vital signs change with age. Now, we do have these things listed for as what is normal, but we also have some normals within certain age groups as well. So normal pulse and respiratory rates, they decrease, and systolic blood pressure increases as we start talking about aging and all of that. So here's a quick little table just to kind of give you an idea about where we want to be, where things should be. And hopefully you kind of see, pulse rate or a heart rate, infants 100 to 180. At adults, we start going, whoa, their heart rate's a little bit fast, just at what's normal for infants. They're not pumping near as much blood with each pulse pressure. So they're needing to do it many more times to equal the same cardiac output. So you see respirations, 25 to 60. Once again, if you run an adult that had a respiratory rate of 35, that would be alarming. That's not something very wrong. Every 1.5 seconds or whatever, they're taking a big deep breath. And then blood pressure. We see that it goes up as they get older. So it's going to be important to at least know some general ranges of this. That'll help you out. I definitely recommend, if you guys are going to, and gals are going to be doing anything in this business, just meaning like EMR, if you're just doing this so you can get something done at work, that's fine. But if you're going to be running calls on your local fire squad or maybe your local ambulance service or whatever, they make little field guides, and you can probably find one on Amazon, I'm sure, that have all of this stuff there. Now, it's not going to help you on a test. It's not going to help you get through really the program. But as a medical provider, it would help you that you can quickly scan to it and know, okay, they're breathing this rate. That's pretty normal for that age. Or it will alarm you that, hey, that's not so pretty good, and that's a problem. So, it can definitely help. It can be as a study aid as well. But for at this level at EMR, there's probably more information in there than you need as a study aid. It may not be really worth the cost of it. But variations in normal vital signs value depend on the following factors. So their size, Our size does that, our degree of physical conditioning. So when I was in paramedic school, one of my instructors had a resting heart rate in the 40s and had a resting respiratory rate of like 8 a minute. Now, he also had ran the Boston Marathon multiple times. He was a long distance runner. So it took a long time. He talked about having to run several miles before his heart rate got above 80. So all depends upon our physical stature and what we've gone through and maybe what medications we're on. And all of these things you got to take that into account. So medication definitely affects things. Factors that increase vital signs: exercise, fever, illness, pain, stress, excessive body weight. All of these things typically cause someone's heart rate to be elevated. Abuse of legal drugs, obviously depending on what someone's on, but that can definitely all increase someone's pulse rate. And then factors that decrease the vital signs. Athletic conditioning, I just mentioned that. Blood pressure meds, abuse of illegal drugs. So you take a whole bunch of meth, it's going to be wound up, right? It's going to be wound pretty tight. You take a bunch of opiates, so think like Lortabs or Oxys or whatever, it starts slowing things down. So actually the body can end up to quit breathing. That's how one of the ways that someone dies from an opiate overdose is essentially it seems very basic, and I'm not even sure that I necessarily agree with it, but I don't know any other answer. But I was at a conference and someone asked one of the doctors that was leading it of why people were dying, so many opiate overdoses were dying, and he said pretty much that the body becomes so relaxed from opiates that they essentially forget to breathe. So because it's very normal for them to, hypoventilation is a secondary effect of opiates, so they'll just normally be breathing 3, 4, 5 times a minute when they're when just relaxed and on those meds and have taken too many. And then you take really way too many. The next thing you know, I guess the body just gets so relaxed that just like, zip, done. Time to check out. So as I said, that's not my own thing. All I know is what I was told by someone who has many more letters and initials behind his name than mine. So 50, what do we got here? 47 minutes with 3 or 4 blips in the middle. But we're at the end, kids. Here we are at the summary. So respiratory system, lungs, airway, circulatory. We got the pump, the pipes, and the fluid, right? Skeletal system consists of the bones of the body. We talked about some muscles and 3 kinds of muscles: voluntary or skeletal muscles, involuntary or smooth muscles, and we talked about the heart muscle being its own. Nervous system, brain, spinal cord, individual nerves. We talked about a lot, didn't we? Digestive and genitourinary, or however you pronounce that. Skin and vital signs and why those are important. So that is where we are. And in summary. So that's it, guys. That is our this lecture. And we'll talk again very soon.